Friends, when you see children born or incidentally have this kind of deformity, what comes to your mind? Physically challenged children, isn't it? Please think no more. Everything you see here and beyond can be corrected 100% in our time. It is unfortunate that we have little understanding on the psychosocial impact of leaving these children to grow up like this. Majority of us will employ them, not just because they are not smart, but because of the way you see such one working. Majority of them have beautiful dream, potentials, maybe even to be a model. But unfortunately, this has also already limited such opportunity. Nevertheless, by reason of observation, by reason of study, some children can come up with this kind of K-leg or what you call knock knee, all right? Usually because of vitamin D deficiency, otherwise it's called ricket. It could also come from infection or post-trauma or even a tumor that happened at the level of the growth plate of that particular knee joint. Be that as it may, this particular leg, just like you have seen a number of adults having K-leg, bow leg by reason of osteoarthritis or rheumatoid arthritis as the case may be, you can see them corrected, isn't it? The same thing also is applicable. For a child that you see having this kind of condition, that particular child can be made to stand straight. Look at it. One important thing here is age. If this very child is found less than 14 years, there is currently a minimal invasive surgery that can be conducted with a very small cut and a clip is put in there. Within 1 year to 18 months, this very child will stand straight. Practically no hospital admission required because the next day that child can be running up and down. All right? However, if the child gets up to 14 years and above, there could be also another form of now surgery called osteotomy, and that particular leg can be corrected like this. And this child with this can be in this other form. It is absolutely possible. All right? Now, looking at another format, you can see some children with bow leg. All right? Sometimes it never starts from day one, but as they're growing, you discover that this child is developing bow leg. What happens here is that the growth factor in the inner side suddenly gets halted, not growing at the pace the outer one is growing. So by so doing, the outer one grows faster than the inner one. And what happened? You see a bow leg. That's what is called blunt disease. Any hope for such children? 100% yes. What is involved in this is that if this very child is also picked up, now the age factor is 8, less than 8 years, and above 8 years. If it is less than 8 years, the same minimal invasive surgery can be done in such a manner that the clip, just like in case of knock knee, can also straighten the leg perfectly well. On the other hand, if it is something that has happened also, osteotomy can be done and that leg can be set. You know what you have done? For such a child, you have built back their confidence, because a number of these children will end up being withdrawn, being in position, even their fellow students, of course you know that children can be very naughty, can even be bullying them, bringing down their potential and their confidence. Such is preventable, and what they are suffering is curable 100%. You get that? Now, going further, you can see also children with their bondage key. Whatever happens, you can see what is called claw foot, the foot bend or whatever. This particular condition, that's why what I'm discussing right now, pediatricians, you have a very strong role to play because you catch them early, give them a future. This kind of condition can be corrected in a number of cases without any operation. Okay? Just a professional serial casting that can be done on a weekly basis, and after 1 year also you can put the spin and also guide it alongside with the shoe they will wear. All these things have been made available that without surgery, this petting foot can now be in position to be normal. Nevertheless, when this baby is gone above 1 year, in that very case, there's still a soft tissue surgery that can be done to do that very correction. But above 6 years, you may now begin to think of osteotomy related kind of surgery to correct. By and by, what we are talking about is that this is not a permanent disability that should be allowed for this very child to be said, you are now a disabled, you are now a special child. They are not. These children are smart. They could be in position to deliver their work. But it's our responsibility to know there is a solution to build them back their confidence to go far in the journey of life. Please share this very knowledge to everyone. Let us give a hope to the children. If you have any child that is having such a thing, check out this very number here. You can post the video and the picture of that very child, possibly the X-ray. Advice can be given, but the bottom line is, it's no longer the same what we have yesterday. A lot can be done in our time. And let's start with the children where we meet them. God bless you as you share this to secure the destiny of our children.